Hi students, welcome to HSC Biology and Module 8, Non-infectious disease and disorders. This is video number 8 and we're going to be looking at nutritional disease. So our focus this time is really just to complete the two previous ones that we looked at. We have looked at genetic diseases, we've looked at diseases associated with agents in the environment. This is about nutritional disease. So as is usually the case, we want you to be able to describe an example of a nutritional disease, to be able to contrast nutritional diseases with the other types of non-infectious diseases, and then specifically to develop a case study that relates to a named disease or disorder that relates to nutrition. So diet is one of these areas that certainly has changed significantly over the last few hundred years. Whilst we've talked about things like hygiene, drinking water quality, medical practice, we also know that there's been a lot of change in the quality of our diets and also in the range of options that we have available to us. So we've kind of gone through a cycle of what may have been poor nutrition to much better nutrition, and now maybe to choices about nutrition that are, I guess, once again, not necessarily meeting all of our fuel requirements. Importantly, food is fuel. What you're putting in your body is what fuels your activity, and therefore it's important to make sure that that food source is a good quality fuel that is going to ensure that your body is trying to work at its optimum. Poor nutrition can not just affect how our bodies behave and feel generally, but they can lead to some very specific disorders or diseases associated with lack of certain type of substance, particularly in the area of vitamins. Once we start to examine some of these important compounds or elements that are part of a good balanced diet, we can start to link in some of the diseases associated with a deficiency of a certain type of element or compound. And these can be caused by a lack of a balanced diet, a lack of certain types of things that are in our diets, and or some psychological conditions that may be affecting our attitudes to food in general. If we want to focus in on some of the specific nutritional deficiency diseases, then what we need to do is to start to look at certain elements or compounds that maybe can contribute to certain types of diseases if they are in low or missing from our diet. So anemia is probably the first one to talk about, because anemia is a blood disease related to the amount of iron. Iron is a key component of hemoglobin, and that's the molecule that transports oxygen around our bodies. So therefore, low iron levels will reduce our capacity to carry oxygen and may mean we become anemic, and along with some of the associated symptoms that are part of anemia. Vitamin B1 has been linked to a disease known as beriberi, vitamin D with rickets, iodine with goiter, vitamin C with scurvy, and I'll give you a quick look at vitamin C as part of the focus of this particular video, and kwashiorkor, which is a protein deficiency. And this is by no means an exhaustive list, just a couple of examples of where specific substances that are not present or are in too low a quantity in our diets can lead to diseases or disorders. Some of these other diseases that can be loosely linked to nutrition often have a much stronger link to psychology. Often these can be related to things like body image, and this remains a problem that we are continuing to deal with in relation to particularly adolescent body image and how that can impact on diet. And then, of course, that's going to affect things like general health. So this is a flow-on effect that starts, I guess, often in the brain, where some things are being processed in a certain way that enables the individual to see themselves or to judge themselves in a certain type of way, and then that can influence behaviours as a result of that. One of the key ones is just the way that our diets are, and this video is made at a time when we're in a COVID lockdown, and so that can restrict some of the normal activity that we usually have. It can give us access to things that we might not have had access to as easily, as well as denying other things. And so there's a lot of different factors at play here, and they may not simply be a function or at least a direct relationship to diet. So do keep that in mind when you're discussing some of these nutritional diseases, of where you think that the source of the issue is coming from. But scurvy is definitely something that is a nutrition disease. It's a disease caused by the deficiency of vitamin C, which we know good sources of vitamin C are fresh fruits. And often you find some of the old sailors were referred to as scurvy dogs, or even limeys, which was a term that was used to describe some of the sailors from England, because this was quite a common disease. Obviously, going away on boats or ships for long periods of time without refrigeration, without access to any mechanism of being able to keep fruit fresh, meant that there had to be other things stored and kept for food, and so therefore there was some significant deficiencies in the diet of a lot of these sailors. And the result of that is a number of important features. Here you can see teeth and gum health is very poor as a result of this condition of scurvy, and you can also see that it's affected some of the skin, particularly around the ears and the scalp. So scurvy is a nutritional disease or a nutritional disorder. It's caused by a deficiency of vitamin C. It's also one of these ones that can be corrected, or at least can be addressed through a change in diet or through what we now have, vitamin C supplements. Of course, this is one of the things that's important when we talk about diet, because a good balanced diet often negates the need, not always, but often negates the need for vitamin or mineral supplements. And so therefore, a lot of it comes down to the centrality of diet, that whole idea of food as fuel. What we put into our bodies is what we use to run our bodies. And the best combinations that we can put together are going to lead to the best quality of health. Thanks for watching.